The most recommended screening tests right now from the United States Preventive Services Task Force are 4 of them. So the FIT test, which is done annually, looking for actual blood in the stool. The Colorectal test, which is a FIT test combined with DNA testing, looking for abnormal DNA that can go along with mutations or actual methylations that can increase the risk of colon cancer. And then colonoscopy, which is usually done once every 10 years. And then the other one that some people may have heard about is the virtual colonoscopy or CT colonography. That's done once every 5 years, and that's where a patient actually takes a bowel prep and then a CAT scan is done looking for polyps in the colon. If they find polyps on those procedures, then the patient needs a colonoscopy in order to remove those polyps.
Yeah, so the type of screening that I recommend is usually the one that's going to get done. So if a patient is not willing to get a colonoscopy, then I'm going to check their insurance coverage and see if I can get them a Cologuard test, FIT DNA test, because that is going to be good for 3 years. If they can't afford that or their insurance won't cover it, I'm going to talk about getting a FIT test. A lot of programs in the state are available for free FIT testing, and we have lots of grant stuff for that here that we use. But most importantly for me is what gets done. And I think that if a patient does not want a colonoscopy, great. Let's try to get them everything we can with a stool test. And then if it comes back positive, I have to talk them into a colonoscopy. That is what it is. But usually then I have some more ammo to say, okay, now you're definitely getting a colonoscopy done.